Health Minister Nickolas Steele says the government is continuing efforts to strengthen the health system for Carriacou and Petite Martinique. In a recent interview with a local media house, Minister Steele said the impact of COVID-19 is an opportune time to strengthen the health system. He announced new services to be offered in Carriacou soon.
Based on everything that we have in place now, we can see that we would be able to have X-ray facilities in Carriacou by the end of July. And that is a byproduct of our strengthening of our health systems overall.
So that's welcome news.
In the nation. But we have the equipment, we have the individuals. It is to get the systems in place, and by the end of July, Carriacou would have the ability to do X-ray for trauma, etc. here, and that we see it as a reasonable timeline as well to have by August or September for the latest the ability to do certain labs here in Carriacou as well.
While commending health workers for their outstanding service, he outlined more areas that need support in the event of a major outbreak of COVID-19.
As a responsible government, that we need to go further, that we need to strengthen that team almost threefold, so that where we were able to identify and communicate to and isolate all contacts from a case within 24 hours, we want to do it within 6 hours.
Right.
So it takes a significantly more resources. It takes more personnel involved. We need to make sure that those persons are trained. The training has started in certain areas, for instance, in the hospitality sector, at the Morris Bishop International as well, to receive individuals, regardless of who the individuals are.
Minister Steele says the arrival of repatriated citizens is being used to test the country's preparedness system in anticipation for the reopening of the borders for commercial travel.
Trial runs have been done. There was a flight that came in from the UK with Grenadian nationals. There are discussions about a flight from elsewhere, possibly from New York or from Toronto or so. The Ministry of Health is using these possible flights to deal with or to test the various systems. We have boats coming in. We have individuals being repatriated from cruise ships. All of these are the various demands that are being placed on us as a government, as a ministry. But we use all of these in the fact that we find as best as possible a way to acquiesce. But in doing so, we're also consistently and continually testing our various mechanisms and making sure that we can facilitate as much as possible.
Cherry and Blackman Stephen, GBN News.